Hello, everyone. I'd like to welcome you to the CO podcast series, Stroke Matters. A special thank you to Northwestern Medicine Lake Forest Hospital for sponsoring this podcast. My name is Christine Winicke, CO Director, and your host for today. The topic for today's call is sleep apnea and stroke. I'd like to introduce our presenter. Dr. Katz-Nelson is a neurology specialist in Lake Forest, Illinois, and has over 22 years of experience. He graduated from Northwestern Feinberg School of Medicine and is affiliated with Northwestern Medicine Lake Forest and Northwestern Medicine Memorial Hospitals. Welcome, Dr. Katz-Nelson.
Hi, thanks for having me.
Thank you. Thank you so much for joining us today and talking about this topic. What I'd like to do is just jump right in and just talk a little bit about what is sleep apnea.
Sure. So sleep apnea is a very common problem, and there are different types of sleep apnea. There is obstructive sleep apnea and central sleep apnea. I think our focus as it relates to stroke should be on obstructive sleep apnea, which is the more common of these disorders. And obstructive sleep apnea basically is an interruption in your breathing when you sleep. And it has really more to do with an interruption in airflow as opposed to breathing proper. So when somebody has an apnea when they sleep, what happens is that there is a stoppage or a near stoppage of air reaching the lungs, but the chest is still actually doing the work of breathing. So it's really a collapse of the airway. And all people normally have some apneas when they sleep, but it's the amount that actually defines whether you have sleep apnea or not. And in addition to apneas, people can have what we call hypopneas in their sleep. And a hypopnea is sort of like a partial apnea, where there's not a complete or near complete collapse of the airway, but a partial collapse of the airway. And it's the combination of both apneas and hypopneas that make up sleep apnea.
Okay. And what are some of the warning signs? How would you know if you had sleep apnea?
Some really common symptoms are snoring, and many people snore, and not all people who snore have sleep apnea, but most people who have sleep apnea snore, unless there has been some alteration to the palate or to the structure that hangs in the back of the mouth called the uvula. So snoring, sometimes daytime sleepiness or fatigue, actually having a bed partner hear the stoppages of breathing in sleep, or respiratory noises like choking or grunting, or sometimes even coughing in sleep are typical symptoms.
Okay. And I guess how does sleep apnea increase your risk for stroke? How does that happen?
So sleep apnea increases your risk for stroke as well as other cardiovascular problems, probably through some different mechanisms. So one of the theoretical mechanisms is that every time you have one of these episodes of interrupted airflow, or let's say if you have enough episodes of interrupted airflow, it creates a strain on the cardiovascular system. And when you have enough of these interruptions in your sleep, the heart rate increases, and there is actually thought to be a release of factors in the blood when we have these sort of surges of high heart rates and low oxygen levels that accompany these interruptions in breathing. There are these factors that are released in the blood that actually that lead to inflammation on the wall of arteries and the development of clot material on the walls of the blood vessels.
Okay. So what do you do? So what happens if someone goes untreated? If you go untreated for sleep apnea, I mean, I guess like you just said, you could have a stroke or there's cardiovascular, but are there other things or, if you don't treat it or?
Sure, sure. So I would say too that a lot of the risk is proportional to the degree of sleep apnea. So
Okay.
if you have pretty mild sleep apnea that goes untreated, the risk of it causing problems down the line is is lower as opposed to higher. And the best way to envision it really is a risk factor. So it which means that it's not necessarily directly going to be the cause of a stroke or the cause of a heart attack, for example, but it's just sort of the chronic sort of interruption in breathing over time, the chronic strain on the cardiovascular system that leads to the increased risk. So having sleep apnea is sort of like having high blood pressure. It's sort of like having high cholesterol. In addition to stroke, it's a risk factor for coronary artery disease and heart attack. It's also a risk factor for the development of high blood pressure itself.
Okay.
So that's sort of the best way to envision it. So it can increase your risk profile, just like if you didn't treat your cholesterol properly, or if you had high blood pressure itself that was not treated properly.
Okay.
Sleep apnea is similar.
Ways like that you can fix it naturally, or like I know that I've heard, you can do machines and different, like how do you treat it, or can you do it naturally, or what actually, I mean, I remember someone had said something to me about weight too. Is weight a factor in that, or?
Yes, yes, weight is a tremendous factor in the development of sleep apnea. With that said, we see some people who are not overweight who do still have sleep apnea, and that sometimes has to do with genetics. But weight itself can actually improve sleep apnea, or sometimes, in certain cases, get rid of it. But weight loss is slow and takes a lot of time, and a very rough sort of approximation is that if you lose about 10% of your weight, you can improve your sleep apnea by about 25%, something like that.
Wow, wow. So that definitely is a way of naturally, trying to correct the problem, I guess, or to.
It is, but weight loss isn't a guarantee. So again, you can lose weight and you may still find that you're having difficulties with sleep apnea.
And so what do you do? Do you use like machines, or what exactly do we do to treat it then so that, it doesn't.
Well, many potential things. So the sort of tried and true and gold standard for someone who has moderate to severe sleep apnea is positive airway pressure. So positive airway pressure means a non-invasive device such as CPAP or BiPAP that you wear at night that basically pressurizes your airway and opens it up. It blows pressured air into the airway and it prevents it from collapsing. So in some cases, we actually use machines that do a little bit of breathing for some people who have some really complicated sleep apnea, but your typical garden variety, common obstructive sleep apnea, these devices really don't breathe for you, but they just are blowing pressurized air into the airway to keep it open. So that's sort of the tried and true. There are some other techniques that people have used, like certain dental appliances. There are some surgical techniques that work better in terms of mild sleep apnea, but tend to have a lot of side effects. In that surgical spectrum is something called the Inspire device as well, which is it's a surgical procedure where a stimulator is implanted into the jaw under the tongue, and it stimulates the tongue to move forward and out of the way of the airway.
Mm, okay, okay. And so, well, how do they diagnose it? Like, how do you know? I mean, I know that, if you don't have a partner, you don't, I mean, how do they actually diagnose that you have sleep apnea?
We diagnose it through some type of a sleep study. So there are different kinds. There are home sleep studies, and there are sleep studies in the actual sleep lab.
Okay. And so you just kind of tell your doctor this is going on, and then they make the decision if you're going to go into a sleep lab or do something at home.
Right. And there are different circumstances where you would prefer to do the sleep study in the sleep lab as opposed to home. And a lot of the investigation of sleep apnea is prompted by telling your doctor about typical symptoms that you've had. And many people actually who have had a stroke or who have had a heart attack, in people who have had a stroke or a heart attack, for example, it may be reasonable for the doctor to sort of screen the patient with questions and ask, do you snore? Do you feel really sleepy during the day? Does your bed partner hear strange noises in your sleep? These kinds of things.
Okay, that makes sense. I think the last question I just wanted to ask you was, are there other resources where people can go, I guess other websites or places where they can research more about this or just get more information?
Sure. The American Academy of Sleep Medicine is one of the best resources, and the abbreviation is AASM. So they have a nice website called aasm.org, and there is a lot of information on that website for patients about obstructive sleep apnea and other types of sleep apnea.
Great. Well, I think that's it. Is there anything else that you wanted to share, or does this pretty much cover it, I think?
I think that covers it. I would say that screening for sleep apnea in stroke victims and in patients who have cardiovascular disease is important. And it's something that's really important to discuss with your doctor if you have had a stroke or have cardiovascular risk factors or known cardiovascular problems.
Okay. Yeah, I would agree. Well, I'd like to thank you again, Dr. Katz-Nelson, for being our presenter. And if you'd like to listen to today's podcast or past podcasts, you can visit the CO website at www.sseeo.org. Thank you. And thank you again for taking the time to do this.
You are welcome. Thanks for having me.
Thank you.